Our disability is our greatest strength. It gives us the supervision to see the issues facing humanity from a more inclusive perspective and the grit to fight back against all odds. Welcome to Super Adaptables, the More Than Walking Video podcast discussion. Welcome to Super Adaptables, the podcast where people of all abilities gather to discuss pressing issues that affect the disability community and their implications for the world at large. We're your host. I am Corey Pheez Lee, C4 complete quadriplegic since 2005.
And I'm Jonathan Sigworth, C7 complete quadriplegic since 2006, both of us hailing from the great state of Connecticut.
Yes, sir, and it's getting warmer by the day. We are recording this on Thursday, the 13th of March, 2025, and in a little bit we'll be discussing Medicaid, how cuts impact the disabled community with our fellow Super Adaptables.
And before we do, I just want to let you know, as always, that Super Adaptables this year is made possible in part by a grant from the Christopher and Dana Reeve Foundation's National Paralysis Resource Center. The information provided and opinions expressed in these podcasts do not necessarily reflect the views of the Christopher and Dana Reeve Foundation. For more information about the Foundation's National Paralysis Resource Center, which is amazing for resources about paralysis, visit www.christopherreeve.org. Also, the views expressed in this podcast do not necessarily reflect those of More Than Walking either, but belong to us as individual speakers.
Yes, indeed. So last podcast, we talked about the history of Medicaid, including Medicare, because they were both signed into law at the same time in 1965 by Lyndon B. Johnson. But it really began 20 years before that under Harriet Truman. And Harriet Truman once said, "The best hospitals, the finest research laboratories, and the most skillful physicians are of no value to those who cannot obtain their services." And during his administration, Truman endorsed a national health insurance program, going as far as saying to Congress that we should strive to make good health equality available to all citizens.
And since his presidency, many healthcare reforms have occurred and have been put into law, such as the Affordable Care Act and, of course, the creation of Medicare and Medicaid. But Truman's ideas didn't come without opposition. Some initially lobbied against it, calling it socialized medicine. And today, 20% of Americans depend on programs like Medicaid, yet massive cuts are a recurring threat. So together today, we'll share about how such cuts lives in our communities.
Right. And with that being said, we want to welcome the other Super Adaptables with us today. And as we call on you, say hello, your name, where you're calling in from, your disability, and briefly, how are you feeling today? So Harley, you take that.
I'm in Paris, Texas. I am a C7 incomplete quadriplegic due to a diving accident I had on my 19th birthday in 1994. And I'm enjoying the weather. It is finally warm where I'm at.
No, you have to stop saying that, Harley.
I can't help it. It feels good. It feels so much better than 10.
My name is Brandon Patterson. I'm 40 years old from Colorado. I am a C6, C7 complete quad from a motor vehicle accident in 2017. And finally, I'm doing a little bit better. I had a pretty bad scare last week. I had to be helicoptered to the hospital for, I had some really bad chest pains, thought I was having a heart attack. Turns out I had a blood clot in my leg. They called a widowmaker that split, and I had a blood clot in each lung, so it was kind of scary.
Oh, yeah. Oh, man, I'm
Glad to have you here, Brandon.
deeply sorry to hear that, but glad to have you here, for
So
sure.
it's what it is, and I'm back home, and I'm on the mend. I feel at least, a good, strong 87%.
Hi, everybody.
Hey.
Hey.
I totally forgot. I didn't even get ready. I'm so sorry, you guys. I came in late. My
Right,
name is
you look great.
Sandy. I'm a quadriplegic C3, C4. I've been doing pretty good these past few weeks. I'm not as bad as Brandon. I didn't need to get flown in or anything, but they did find like these 2 tumors on my kidney. So I had to get kidney surgery last like 3 weeks ago. I'm recovering. I'm doing pretty good. I mean, well, as a quadriplegic, you deal with a lot of UTI issues, and thank God I'm getting through it. But ironic, we're talking about Medicare today. It's a perfect time to talk about how they be trying to screw us over and doing the most when you be needing your care.
That
Sorry.
is no. It's a fact, man. You know, I personally am dealing with a UTI, so like you're right, you're spot on when it comes down to um, people who are high level quads and neurogenic bladders and all of that. Um, we deal with a multitude of things that require care that we need to survive through. It's bigger than just drink some cranberry juice and what have you. The issues are important. It doesn't matter how many people show up. It's about voicing our unique perspective on these issues because many of the issues that we're talking about affect us directly. And whether you participate in one social safety net or another, somebody who is just like you, who is living with a disability, um, may be put at a disadvantage as a result. It makes me kind of think like, is there like disability prejudice, but within our own community? Like you may look at the person and go, I don't use that. So, I'm going to go against, I rather have funding cuts for the following things. You know what I mean? Like a little prejudice against one another if we don't share the same disabilities. I'm always curious about that. Which brings us to question one. So Medicaid covers millions of Americans nationwide, and this has allowed countless people access to critical medical treatment, such as medications for diabetes, mammograms for breast cancer screening, and so many other important life-saving measures. If you are a recipient of this benefit, what has been your experience with it, and how has it helped you, or if it hasn't helped you? And Sandy, I'd love for you to take that.
Well, the insurance that I have, we're talking about Medicare or Medicaid?
Medicaid.
Yeah, we're talking about Medicaid.
Okay, yes. Medicare is like a buffer for me because I get Medicare. And so whenever I can't cover something, I get Medicaid, and then I also get food stamps through Medicaid. So it's a big help in my life. I remember in the beginning of my paralysis, I didn't get all the services that I need because lack of information. So a lot of the reasons why I wasn't getting like top level care or long-term care for certain things that I needed was because I didn't know that I could get it. And it's not like they're volunteering this information. So it was very hard the first 3 years of my paralysis. And I've been paralyzed for this year will make 10 years. So whew, it's a long journey.
Wow. And I mean, that's a good point that a lot of these benefits, that you don't just get the benefit of Medicaid, but other benefits are tied into it. And so if the primary benefit goes away, what happens to all these other programs? So if the regulations change and if you're no longer eligible for Medicaid, you're also no longer eligible for those other benefits tied to it. Harley, how about yourself?
The bad thing about Medicaid is you have to keep reapplying for it. And the moment that it expires, you lose your benefits for those few months. So I might not get my diapers, or I might not get my food stamps, or, if I go to the doctor, they might not cover the extra bill that they usually have at the end, which is scary sometimes because, with everything going on, I'm super independent. I do mostly everything on my own. So if I forget to, reapply, sometimes I can go up to 3 months without having my care because it's a long process to apply. Medicaid could be a headache when it comes to reapplying. It's not like I'm putting any new information. I don't understand the keep reapplying after part. But I believe the reason why they do that is because they have so much people in the queue. So they're hoping that people don't reapply so that they can lose their benefits so they can go back into queue. And then that's 1 or 2 or 3 months of not dishing out service.
you're a veteran, right? Now, did you get injured outside of service?
Well, I don't fully get all my veteran services. So I don't get medical services from the VA. Oh, and then I was a reservist, so I don't get 100% care from them anyways. My status as a veteran is I don't get like all the benefits. I only get some benefits, like my schooling, the SGLI, I get um the Montgomery bill, I don't get Medicare. I don't get help from the VA.
Yeah, and it just, we were talking about veterans benefits last year, and I mean, excuse
Last
me,
month.
last month. And this is one of the
Feels like a year ago.
issues that kind of arose. We're talking about how, like, you can have service to your country and what have you, still not have access to full benefits, even though you serve. But, it's like,
It depends how much active duty credits that you have
sure.
when it comes to the military. So most of my active duty was only 2 or 3 weeks out of the year, and I only did 4 years in the military. So I didn't accumulate enough credits because I was initially supposed to do 8 years, but I ended up getting out of the military early because I had a child with cancer who passed away. So I wasn't unfortunately able to get all my benefits. And then even though I was married military, because I did marry somebody in there, we divorced like 6 months before my accident. So even though we were married for like 7 years, I got divorced 6 months before my accident, and I lost all my VA benefits.
So on top of part of our discussion last month was also the idea that you have to somehow earn the health coverage that the VA benefits offer you. The VA benefits in their entirety offer a array of services for people with disabilities that otherwise you don't really get access to very easily. And your situation also kind of exemplifies that even within the veterans benefits, like you have to earn you have to earn enough, right, in order to get access to that. And so we've been harping on the importance of universal healthcare, and like, don't we all deserve to just get the healthcare that we need? Is what we're all fighting for. But Harley, let's pass it on to you. What's your experience been with Medicaid, good or bad, and how has it impacted your life?
Well, let's go back almost 31 years. When I first had my accident, I was released. I was ICU for 5 days, and then regular room for 3 days, and then I went out to rehab for a month and a half. And the doctor wanted to keep me for an extra month, but Medicaid's like, oh no, she's past the life and death stage. She's stable. Send her home. She'll figure it out. And so that was my first experience with Medicaid. And then about 2.5 months after being released, I was doing outpatient. And I was like, when are we going to start working with my legs? I want to work with my legs. I want to fight to try to walk. And, oh, you'll never be ready for that, And I was like, then what's the point of being here? I got 2 kids. That's weightlifting enough, guaranteed. I can do all that. I need a transfer on my own butt. That's how much weight I got to move around. If all you're going to do is work on my arms and stuff, I can do that at home. See ya. So I left. I quit going to outpatient rehab. And then I'd say after that, for quite some time, Medicaid was good to me. I got the wheelchairs I needed. My very first wheelchair was a Quickie P200. It went 8 miles an hour. I took off the wheelie wheels off the back so I could pop wheelies with my wheelchair. My next chair was the same exact model. So I did really good with Medicaid. And then I got Medicare, and okay, things were a little different, but they weren't enough to really see a change until I'd say in the past 10 years is really where I really started seeing changes. Actually, about 15 years. They all of a sudden didn't cover the personal washes for down below and the creams and stuff to prevent bed sores and all that. And I haven't had really bad pressure sores on my butt. Thank goodness. I've had a couple internal, so I've got a couple dents on my butt. But recently it's really changed, and now Medicaid no longer covers my butt covers, my underoos, as we call them. Depends, as some others call them, and some people call them diapers. Me personally, if they ain't got a sticky tab, it's not a diaper. We call them underoos. And Medicaid doesn't cover it. Medicare never has. So now I'm stuck paying out of pocket, and I already live on a below poverty income, and my entire check is gone within 3 days of getting it. And so I'm getting ready to actually go to Social Security and ask, how do you expect me to live with this mediocre income that just barely pays the bills, doesn't even pay for food? I have food stamps for that. That doesn't even go far. I mean, $200 in food stamps barely goes a week and a half, 2 weeks now. It's scary. If I didn't live with my mom and my other half, I don't know if I'd be here, to be honest. Between starvation and the lack of supplies that is covered now.
I'm sorry, Harley. Do you get long-term care with Medicare? With Medicaid?
What do you mean long-term care?
Like there's this program through Medicaid, like you see how you're disabled. I forgot what the program is, but like what I don't know how your state runs it, but in our state there's long-term care through Medicaid. And if you get long-term care, they're supposed to cover all those things. However, if they're not able to cover those types of supplies, they still give you like $150 in pharmacy assistance. Like they give you $100 voucher to their own personal pharmacy. And then if you get Medicare, Medicare has a program like that as well, where they give you a voucher to get pharmacy type items as well.
They don't do vouchers down here in Texas, but like I think the most I've paid for a prescription is $1.20, and that's it. And that's out of pocket. And I never do those. I haven't had a care provider or an assistant since 2002. I've been completely independent on my own since 2002. The only time I had a care provider, well, I didn't even really have a care provider, it was my mom. She flew to Utah when I had my second spinal fusion, and she was there for a month. And then I, neck brace and all, not allowed to move, took care of myself after that. So I'm completely independent. So I don't know if I'd qualify for long-term care.
And Harley, are you on Medicaid or Medicaid buy-in?
Medicaid.
Oh, okay.
Down here they call it United Healthcare.
Yep. Yeah. We'll get into that.
That's the worst one.
We'll get into that in our next question. But also wanted to note before we pass it on to Brandon, sorry. For everyone listening, that Medicaid is the only. If you haven't picked it up, it differs from state to state. Like states can decide what waivers to use, what federal programs, because the federal government, is supposed to fund or help reimburse states for part of the expenses. It's partially funded by the states and it's partially funded by the federal government. And states can opt into different federally offered programs. And states like Texas opted out of several. And, it varies from state to state. So what's available in Florida for Sandy is not necessarily available for others in Texas. So, and Medicaid is also the only insurance across the board that covers the highest level of caregiving. Medicare doesn't cover 24/7 caregiving. Only Medicaid. No private insurance will cover that unless you have long-term care insurance in some cases. So it's really important in that aspect as well. Brandon, what is your experience with Medicaid, the good and the bad?
Honestly, I've always had kind of a experience with Medicaid. I happened to be on it before my accident, which kind of was a godsend because, 30 some days in ICU, you know what I mean? You can guarantee that was $1 million almost,
Mm-hmm.
3 next later, you know what I mean? Like, so that was huge. And Colorado has kind of a really, really, really great Medicaid program as it is. And then when I got injured, my now ex-wife was the my advocate and put me on that long-term Medicaid that we were just talking about. So really all of my everything at the time had been covered. And so far, I mean, other than getting, you know, taking time for prior authorizations and stuff like that takes, you know, time for whatever, but I generally have had an all right experience with them.
I have a question. Sandy has said that she at one point had forgot to re-enroll, and I believe under the Affordable Care Act, it was or during COVID, um, it was just kind of like automatic re-enrollment for people. But does like the federal government send out any kind of reminders to say, hey, listen, you're closing in on your window. We'd like for you to re-enroll. Is there anything like precautionary measures like that?
I think it would be the
Actually,
states that would be sending those out.
Or
it
even
kind
the
of
states, or even the states.
Yeah.
kind of does come, especially like with that long-term Medicare. It's a little bit different because it's like instead of a yearly re-enrollment, I think it's like 3 or 5 years that it's a re-enrollment, and they really do kind of give you like, hey, in like 60 days, you know, you got this
Yeah,
amount
they
of time
do.
to re-enroll. They because it's a longer like term or whatever you want to call it. You know what I mean? They are better at reminding you instead of just the year programs.
And they send one to your case manager too. They send a reminder to your case manager to remind you to get everything renewed. And then with your case manager, you're supposed to do every 3 months where they update all the information in your long-term care. So as far as in Florida, with the long-term care people with Humana, that's how I have, is pretty good. Lately they've been these last few years been pretty good. But in the beginning, not knowing all of this stuff, it was not fun. That first time I lost my benefits, it was a hassle getting it back, calling this, that, and the third person. It was just a lot. They was like, you knew you was as if they was punishing me for not doing it on time. But yeah, he's right. It with long term care, it's like every 3 years almost, or every 2.5 years for me. They make you renew it.
Thank you guys for sharing. So, want to move on. So, how is Medicaid managed in your state? By state or private companies, also called managed care?
Their organizations.
And which would you trust more to manage it better, and why? So, for example, Connecticut. I'm not on Medicaid, but Connecticut manages its Medicaid program known as Husky Health, using a managed fee-for-service approach where the state pays providers directly for services rather than contracting out with an MCO on a capitated basis. And what that means, capitated basis, it's basically if the state contracts with an MCO, they have like 5,000 people on Medicaid who they manage. That private company gets reimbursed the same amount for each beneficiary, no matter if they're a high-level quadriplegic needing a $60,000 wheelchair and home modifications and everything else, or if it's someone with a broken leg. So you see where this ends up is there's a financial incentive to not necessarily dish out all the services that are needed by the beneficiaries who require the most help. So do you guys know if your state is using an MCO or not?
I honestly don't know. I've only been here a year and a half, so I mean, I'm still learning things. I know that they have one called United Healthcare Plus. Unfortunately, since I'm in a rural area, the only wheelchair company anywhere near me doesn't accept that one, which sucks because then I could get an extra $180 a month, which would cover my medical supplies. But
Well, yeah. So with United Healthcare, that is a managed care organization. So that is a private company that operates in multiple states. Brandon, how about you? Do you know what your Medicaid program is called, or someone manages it in Colorado?
So here at one point it was known as Rocky Mountain Human Services, but because it's a privatized company, they lost their bid last year, and now it's another company called Developmental Pathways. And honestly, the new company's like way better because all of the Medicaid program here has been completely like revamped from how they managed everything to their case management system. So
Awesome. That's a caregiving agency,
yeah,
but that's different from a company that manages or runs Medicaid, which would then pay for the caregiving services provided by that.
Yeah, I did a little research briefly. Colorado's Medicaid program, known as Health First Colorado, utilizes a managed care system where private insurance companies administer the coverage. So it's partially privatized,
Partially, not fully.
same as Florida and Texas.
Mm-hmm. Cool. Well, yeah, it's interesting because Connecticut is flirting with the idea of using MCOs for its long-term care Medicaid recipients. But one of the challenges that we see in other states is because of the capitated strategy of reimbursements. You have people in nursing homes who don't end up with their wheelchairs for years because the companies don't want to pay out. And while there's on paper there's this idea of improved efficiency, the efficiency really kind of boils down to savings in dollars, not better services in the quality of care that's given.
Isn't it a little bit ironic? It's like saving dollars for exactly what? Is it to keep the program alive? Can we redistribute these funds for other things we deem as more important?
Well, I mean, it's also important to note that United Healthcare, it was the CEO of United Healthcare who was gunned down in New York City in December.
That company is so bad. All I can say. I used to work for them when I used to be working in call centers, and the things they would do to go out of their way to gyp their customers is horrible. I accidentally one time switched over from Humana to United Healthcare I don't know what got into me that day. I was in a hospital. Guess I was on too much drugs or something. I don't know. It was around that time where it's open season to change services with these companies, and they called me. The girl sounded so nice and had a great pitch, telling me all this extra benefits that I will be receiving. And the day that I got signed up, everything that I ever had was canceled. And I'm like, I guess because they use a different network, like PPO and all this stuff. I don't know, how it works, but it was a nightmare. I had lost my agency. I lost so much benefits in just a week just because I switched over to United Healthcare. I switched back to Humana and a quickness. Thank God it was still open season, so I was able to do it. But imagine like navigating through that. Their system is so complicated with so much stuff to learn and to understand. I feel like they make it so complicated on the customer just so that they can be like, oh, well, if you look at this part of your care, this is what's going on. Like, there's so many ways to get the customer.
The system is made more complex, as you mentioned before, in order to reduce the services that they have to provide and to kick people off.
Just working for them for 6 months, I ended up quitting because I seen how much of a dishonest company that was.
So moving on to question 3. Present day, there's ongoing discussions about possible cuts to Medicaid. Have you guys heard anything from your local leaders addressing fears associated with those possible cuts? And what are your thoughts on those possibilities?
So far, I haven't heard anything at all down here, which is surprising because Abbott likes to talk. So I'm surprised it's been quiet on all fronts. I'll admit I'm a little nervous because, it's already, if I do need any When I was married to a soldier at Fort Hood, I was curious about a caregiver while he got deployed to Iraq. And they're like, we can't help you because the only thing you would need help with is housekeeping. That's considered custodial, and they don't do that. My biggest fear is for other people that do need care providers and stuff, what's going to happen to them? As for me, I'm so used to riding a struggle bus that to me it's just another day in the neighborhood type of thing. And I'll ride it out like I've been doing for the past 31 years. What can we do, really? I mean, the federal government is so much, it feels like the federal government doesn't listen when we do speak up.
I think that's, part of the issue, right? The issue is the complexity of the system where it makes it almost impossible to navigate through when you want to get on the system. And then to your point, you get so frustrated with struggling with it that you're like, well, I'm accustomed to it. And so whatever comes up, I'm just going to deal with it head first, and which is, dangerous because you're also subjecting yourself to issues that could arise, if you don't have the proper materials and equipment to make sure you can preserve your bottom. You can easily, develop pressure ulcers if you're not getting care. You're going to be in a bed all day, and you're not able to transfer, which can also lead to health complications. I know here in Connecticut, back on March 6th, one of our representatives, Joe Courtney, he had joined our governor, Ned Lamont, with another representative, John Larson, and they spoke about the consequences of the current budget that's trying to be passed. And what they spoke of is similar to what President Truman had said, what we talked about earlier. It doesn't do anything for the people who don't have access to the care. And, Joe Courtney had said, federally qualified health centers like the one we are at today, so they held this kind of like a town hall there, are right in the crosshairs. They provide primary care, behavioral care, health, dental health, and a whole host of other essential services. Medicaid is the workhorse in terms of making sure that the doors stay open and lights stay on, because their mission is to treat people regardless of ability to pay. And I think that's really what it's all about. But Sandy, how about you? What have you heard from any of your local leaders regarding Medicaid cuts?
Because I've been dealing with a lot of issues with housing, I way back when, because of Jonathan, actually, I reached out to a couple of my local, the people that work in this community, and I've gotten some really good responses. And I want to believe, because I live in a retirement state, and it's so many old people, and it's so many people that do need care, that they're on top of it. I feel like every time I do ever reach out to like the mayor or the people, the congressman people that's in our in Florida, I feel like they've been responding pretty well. Especially like there's this group that I'm involved in that's constantly sending me these like these polls or these things to send letters to our congressmen and our leaders in Florida so that we can get stuff like in the Medicaid program that is, hurting our communities. So I try to stay on top of it. I haven't heard anything crazy lately. I know that when I did speak to somebody, they said I shouldn't worry about it because we got too many angry people in Florida waiting for Trump to do the wrong thing. But I don't feel like we need to be too much worried as of yet because Trump lives in Florida, well, basically is always in Florida. There's always people in his ear about, don't cut Social Security, don't do nothing to Medicaid. So hopefully he takes heed to those, to those. He said in the past that he would never mess with those things, even though I've heard rumors of, big changes in those departments. But I'm praying that, not, even though if they don't, make any big changes for positive, they don't mess with it at all as of right now.
Thanks for sharing that, Sandy. Brandon, what are you hearing where you are?
So I haven't heard anything about any cuts in Colorado, and personally, I don't see any way that Donald Trump would be doing any actual cuts like that. I could see like the big changes I would like to see him actually do is, go through and kind of do a big kind of like an audit of the system. Like if you're getting Medicaid by fraud, then you should absolutely be cut right on the spot. And honestly, for something like that, if you're getting it by fraud, you should have charges brought against you. And if that audit happens and a lot of people are cut because of their fraudulent actions, that leaves more money for us that actually need it, and it might make the system better for everybody involved. Like the system that you can't get like your butt things, you know what I mean? Like maybe in the system where we have more money for the collective that needs it, it would make the system better in the long run for the country. So that's what I really see happening is that he's going to go through and, just cut the people that aren't needing it. Because for a while with that Obamacare, if you just signed the paperwork, you automatically had Medicaid, whether you needed it or not. And I'm sorry, if you can be out working every single day with you, I'm sorry, pay for your own damn insurance and let me my day.
Yeah, I feel you. It's
So,
like that for real. So I feel
so
like a lot of people do get services that they don't necessarily need per se, like the people who actually need it. And then the reason why that hits so hard is because same with the housing situation. A lot of these programs I feel like are supposed to be for people that actually need it, but you see, to do body people getting all these services, and you're like, how'd you get Section 8? And I've been trying to get Section 8 for like forever. Like it's crazy.
so it's true that there's talk of cuts, and the way that cuts would come about are not necessarily cutting Medicaid. It would One method is reducing the amount of reimbursement, as we mentioned, that the states get. Right, the lump sum that we pay for states for a bunch of different programs, we're going to reduce that amount. It's up to the states to fund their Medicaid programs. And so what ends up happening, because with people with disabilities, we are the costliest beneficiaries, right? We're the ones who need those chairs. We're the ones who need those medevac helicopters to hospitals, for your blood clot, right? For our diapers, for our caregiving. We cost the most. So what happens when states have less in their budget to spend on Medicaid recipients? It's people with disabilities who start feeling it the most, because the things that we need, like our diapers, like our catheters, like those things, the expansion of those services are not going to continue. And as Sandy mentioned, work requirements, you can automatically, private companies may automatically add notifications that if you don't reply within a certain time, you're automatically disenrolled, right? And guess who has a really hard time managing technology or opening letters? It's people with
Exactly.
disabilities. And for an able-bodied person who gets kicked off temporarily, sure, that's an inconvenience. For a person with a disability, we die,
Yeah.
and our lives get totally disrupted. So while there is obviously waste, there is Medicaid costs $880 billion to run, right? And the amount of funding that is currently being talked about that needs to be cut is, Corey, correct me if I'm wrong. Do you know the numbers of how much they're
Yeah,
looking to?
so I think it was in 2023, it was about $871 billion to fund Medicaid. But like to your point, the cuts that they're talking about is 880 billion, which is $9 billion more than what the current program is even supported under. So you have to.
So there's no way to find that amount of fraud that doesn't gut the system, or that doesn't starve states from federal funding. So we have to be really careful with what our leaders say and then what actually happens in our states. And either way, it's not fair for the programs that helps us to live and function being being used as a bargaining chip.
Yeah, and I think that's true. I think we have to all be careful about, the framework of why things need to be cut, as opposed to, all right, show me the amount of waste, fraud, and abuse in this program, and now I can understand why you want to cut this amount. But does it really have anything to do with so much waste, fraud, and abuse? I think that kind of gets into our head that that's happening to such a great degree because we may have seen it, or a news article may have come up where a person has been caught for doing something wrong, and then we kind of like say, "See, they're there." So I think we just really have to be careful in how we're framing it, and have all the evidence presented to the American public, because it's not just about waste, fraud, and abuse in 2025. Medicare and Medicaid have been around for 60 years. And people, like, even in this first 3 years, 20 million people signed on because they needed the services, right? So this is not a new case that we need to litigate. It is about trying to fund it properly, but let's make sure that we're doing it on behalf of the people who need the system the most.
Absolutely. And as people with disabilities, if anything, is we've learned how to empathize with people who are different. We can stand up and say, look, we don't know if you have a disability or not. If you're in a vulnerable position, you deserve to have access to the services that can make you independent, that can give you a chance, just as the services have done for us. But thank you guys for joining and sharing your perspective as we try to raise awareness about the importance of Medicaid, how it can be improved, and why it needs to be protected, and the difference it makes in our lives.
Absolutely, absolutely. And also, stay tuned and join us next month, and sign up for the More Than Walking newsletter at morethanwalking.com to learn about the topic we will cover next. Also, like, comment, and subscribe to our More Than Walking YouTube channel to watch each podcast. We'll be dropping new episodes every Monday or so. And follow us wherever you listen to podcasts. Just search for More Than Walking or Super Adaptables.
And until then, remain encouraged, stay hopeful, and above all else,
Keep adapting.